troopers for sitting through all this. So hopefully, again, this is the second major innovation project of our Futures team. And again, I think this will validate a lot of what you're doing, and we're looking for fun people to work with, so I want to share a bit of it. So I'll explain what it is. So now remember, Hope was home care. This is creating, expanding our pipeline into how we work with senior living, residences, homes, and that kind of thing. Okay, so I'm going to skip this. So what's the missing middle? So if you look at Canadians, you guys probably know this, but it's pretty, shocking when you look at the data. So this is Steve, he's our persona. The median income of aging people in Canada is a fixed income. It's about $27,000. That's largely just getting your pension and whatever benefits, right? So if you're using that to finance a bit of housing, your food, there's not much left over. And then the other data in Canada, we have a lot of newcomers, and only about less than 20% of aging people in Canada have 5 years at least of savings. So the missing middle is about 67% of Canadians are what I just told you. So if you're on the low end, if you've got less than $27,000, there's services for that, right? There's, welfare and ODSP and lots of services. Society's got your back. If you're on the other tail of the bell curve, you can afford retirement living and all these other things. You've got retirement savings. That's 30% of the population. For the bulk in the middle, there is nothing. There is no option of a housing model that can work with a fixed income that doesn't trade off agency, choice, dignity, etc. And we visit people in their homes every day, and we see this, and we see the tension where the resort is to basically go live in a hospital or live in a state-funded retirement, long-term care facility and those kinds of things. So again, remember we talked about this mindset changing. Well, then is there a different way to think about what home is and what housing is for this big population of Canadians in a new way? The headlines, so if we believe the way to do things is to continue to warehouse people when their physical or other limitations are met with their housing. This is the UK, where they're anticipating a doubling of the elderly. You guys might remember the pretty seminal study Conference Board of Canada did. I can't believe the study came out and it didn't get the attention. They really quantified we need about 200,000 more long-term care beds if we kept doing things the way we're doing. By 2035, that's about 40% more stock than is built ever in Canada. And then, I love the conflicting headlines. So in Ontario, I don't know what your numbers are, but 70% of our beds in our hospitals are used by people who don't need to be there. Some are up to 25%. But yet every year there's a whole policy push to just build more beds, right? So our solution was to go where the government has to pay for you to get care, and that's been these institutions, and it's kind of not feasible. I'll just skip that. So this is kind of our reframe at Zayna is, we see beds everywhere, right? We see the home as the place where any, like I said, pretty complicated medical care can be done, and a home that can create health and meet you where your needs, your expectations, your aspirations are, as for the future of aging. This is the lens through which we do our work, both in home care innovation and now in senior living innovation. So that was our problem statement that we set out when we started this project. I guess it's now 18 months ago. How might we create homes that any senior will move into because they want to, and they'll stay because they can? That was our mission that we kind of took on to see, is there a different way to think about housing that's affordable, that's attainable, and that people want to, and they can, and they're proud to be in, versus being forced by a crisis. So then we did about 7 months of discovery to see what's going on in the world. So we collected amazing signals of jurisdictions, models all over the world. Some of the things that jumped out at us that you'll see will feed into our design principles. Completely new ways to think about amenities in a neighborhood. The old days of there's a shuffleboard and maybe a park and They all kind of look the same, like really reimagining. This is an ice rink up here, kind of mixed amenities. Intergenerational, we've heard it all day, so really amazing new designs that are building that from the beginning in the design, and I'm not talking like a daycare in the main retail concourse, right? That's pretty old school. So really neat kind of programming and business models. Other inspiration, kind of this idea of collective space versus obsessing about individual space and my backyard and my balcony. So just really neat repurposing of spaces that bring people together. So that was a big inspiration in our design. And then a lot of discovery with people that are kind of trying to do the same thing, but they're coming at it from whatever their starting point is. Right? Our starting point is home care. So of course, if you're a hammer, everything's a nail. So we needed to see how do other people think about this, because just like the blue zones, this is going to be a multi-sector transdisciplinary thing. So lots of great groups across Canada that are in kind of architecture, development, financing, policy shops, think tanks that have been thinking about this. A lot of unusual suspects. So you guys know Leon's? Amazing meetings with the CEO of Leon's, their executive team. They just bought a big patch of land and they want to imagine a whole different city, right, with empty land. One of my favorite is the Ontario Provincial Police. They showed up at our community groups. We're like, who invited the police? So we had a lot of focus groups. And it turns out they know a lot about this population. Like they're fielding calls, you know, when a person maybe with dementia has just hit their spouse or just stuff. And they have a lot of ideas and they want to solve this. So they've been amazing to co-design with, academics, the libraries, and then a lot of kind of traditional care providers, probably like a lot of you, nonprofit, for-profit. So just a great kind of community that's all thinking about it the same way. And we learned from all of them and kind of took the best of. A lot of field work, a lot of focus groups. I was doing chair yoga every week with the seniors in a low-income area of Toronto. This is one of our community sessions we did at Sidewalk Labs. So does anyone know, Richard, have you heard of Sidewalk Labs? So Sidewalk is a spin-out subsidiary of Google that was kind of basically created to be a new infrastructure as a service to create forward-looking cities. So think about, you have your utility company, you have transit, you have housing, you have all these things that are their own utilities. So could they design a business model for the future? This is like a 20-year product development cycle. You don't do this in a year. They did a global search for where are they going to build their first prototype Sidewalk City as their kind of first product, and Toronto got selected as a piece of land. So we've done a lot of work with them to say, well, by the time your cities are out, 20% of the people are going to be old. And they just weren't thinking about designing for that. So they've been an amazing partner learning from us. Another big signal we've seen, and I know when I was here with Covenant, they're kind of getting to this space. One by one, health delivery organizations, traditionally hospitals, are getting into housing, right? One, they own land, or the Catholics or the nuns or the Jewish own the land and they'll give it to them for pretty much free. Housing is a massive determinant of health. And some are doing it because they also get a very good business model. Real estate is good cash flow. So that's been happening all over the US, but we got a lot of learnings from like Briere in Ottawa, CAMH in Toronto, and then UHN in Toronto just announced a $10 million development for housing. So we said, okay, we're a service org, we can get into housing, right? There's others that have done it, so that gave us a lot of confidence. So kind of, as I've already shown the future of aging, our biggest ahas, times are definitely changing. 93% of Canadians, have declared they want to stay in their own homes and communities. So you think of the loss when housing changes for you is also a massive loss of community. So how do you design to thwart that? Lots of barriers. There's not enough stock. There's not good enough services that can allow people to meet that 93%. And then the biggest barrier, well, one of them is just affordability. And it's a difficult business model for traditional players to provide affordable housing for seniors that respects their autonomy and agency. But over the backdrop is these expectations, and so a boomer was born every 10 seconds. So 10 million people a day in the U.S. are kind of entering the bulge that have very different expectations for their experience of housing. Think Margaritaville. And then the other big thing, our aha, was there's a lot going on in the market that's creating the conditions to do something very different. So first is there's a lot of new entrants, like us, like hospitals, like Google Sidewalk Labs, Leon's, the police. These new players that are bringing expertise and not relegating it to the same people who used to run all seniors housing, and amazing incentives. Rarely does our federal government get its act together on a pretty complex social policy. For seniors housing, they did, right? Some really interesting policies, a lot of capital opening up and really good incentives, but they're tied to a nonprofit developing the housing. And there's not a lot of nonprofits that are doing kind of housing at scale with a viable business model. So we saw that as a good opportunity to kind of explore getting in the space. So that's kind of what our kind of working model is. We call it purpose-built affordable housing for seniors. So the purpose-built is got purpose around these design principles, around healthcare, around agency and community. I'll show them. So we're really designing for both hyper affordability, but also all your adaptability to physiological barriers and community opportunities. And so they're basically rented apartments with a healthcare service wrap built in. That's kind of the basic of the business model, but very affordable and kind of beautiful and attainable and aspirational. So some examples, that we're not the first to think of this. We're just trying to build a business model that lets us do this at scale. We learned a lot from this center in San Francisco. This is a beautiful kind of affordable housing space in the city for aging adults. This one in Winnipeg, I don't know if you've seen the Emmanuel Village. So this was great because the partner backing it was United Church. So you get really good economic break there. So we learned a lot from them. Mahogany is like a developer in Toronto who just wants to build beautiful, affordable housing and win awards for environment and eco and just a lot of things, and he's been doing it. So he's kind of our key developer partner because our values align really nicely, and he's intrigued about a version of a development like this he's doing in downtown Toronto for seniors. And then the last is in Sweden. Andreas Martinlof is an architect who's really pushing the boundaries on materials and affordability without trading off anything for aesthetic, and creating these beautiful kind of new concepts of architecture. You'll have to read the story, but that really triggered us to say, don't accept what the builders think they know how to build. Really push the boundaries and kind of design with materials that are very forward-looking. So kind of put that all together. This is about a year of discovery and research, and that landed on these 7 design principles. So this is probably the most highest value slide, because there's a lot of work. Every word on this page was crafted. So this would be like if you were designing a car, this is your minimum specs. Once you've got design principles, everything else kind of falls into place. So it's got to be a high quality home, it's got to inspire pride, and it's got to be a big spec we give to our architect. It's got to be operational efficient over the long term. Remember, people will be in this age stage for 20, 25, 30 years. It's got to be ready for that and account for that. Second, it's got to be designed so the building creates health. The building maximizes well-being, not just the physical building. Everything about the community activated is built into the design. Third, highly adaptable and flexible. From our research, you guys know one crisis and everything changes. So how do you design housing that can adjust for that? So you're not rooting everybody up and moving, and when you move, where do you go? The only place that has stock, wherever that is, right? So a lot of adaptability if somebody dies, if your circumstances change, if the kids want to move in. So build into that. That's happening a lot, the kids are moving in. Another part is we can't predict too much of the future needs, but we can see the signals. That's a big part of why we wrote the book. So how do we design to anticipate that? I'll give you an example, right? What do we do wrong in healthcare? We design policy for the technology we knew of the day, called the fax machine. We made that a law. The phone was the only thing around when we created a word called telemedicine. Why is it tele? So to be really careful about not locking ourselves into constructs that we're going to regret later. So it's a big intentionality in the design. The fifth, absolutely fully integrated, porous with the community and the neighborhood. Most models we saw, like a community agency comes in and does services in a building. We are imagining something very different. So very open, very diverse. Whatever services would be in our buildings would be for the community, not just for our residents. And then number 6 is rooted in an extremely non-medical model of health. So that's where we needed the futures team to work on this, not our formal clinical team to work on this. So just a different way to embrace the future of health, the health of the building, a home that creates well-being, and residents choose their healthcare workers. I don't know about here, but in Ontario, if it's supported living or assisted living, the agency gets a certain number of units, and you're kind of stuck with what you get. So new business models, and then finally, of course, technology and nature and all these other things. So that's kind of what went into the design, and then we went out and met a bunch of these cool architects we've been meeting, and SVN ended up being the one we thought was very like-minded. They really wanted to work with us on creating really a new market. And so we built our first prototype. It's like an 80-unit kind of apartments, not too high, that respects all the design principles. I can't get into all the details, but some of the examples, just to show you the modularity that was built into the design. A big insight when we met people was some people absolutely want to live by themselves in 1-bedroom unit or 2-bedroom. Others want to be in clusters. So remember when you went to college, or the dorms with the 4 and you share the toilet? No, you share the kitchen. So you just adjust for that. You allow for that. When Briere built their 280-bed independent living facility off their geriatric hospital in Ottawa, their biggest regret was they didn't build more cluster living. People really wanted that for the community, and it's a huge break on price, right? So we built that in. These are just all different kind of amenities that we've built in against adjustable depending on the community. So for example, if we're going to go to a Korean heavy community, you'd have a different maybe constellation from something else, right? And you can adjust, do you need parking spots, do you not? And then the last thing, which is big when land is very difficult to find, because a lot of these business models only work because a church or a city gives the land kind of for free, or like for $1. So we had to design it so it could bend around corners, be like this, be like this. So the units are all the same, it's just like different configurations. So a lot of that went in. So then the last thing I'll say is, different communities want to own assets, or different ones don't. So we're kind of designing a business model that allows us to either be the 100% owner, 50-50 JV, or the community owns, and we provide the design and the services. So we're playing around with those, and we're now kind of going through different partners who want to get going on our, hopefully in the next year, our first build, where there's the real estate part and there's the services part. And each of those is a different business model, so we're playing around with that. So that's all I wanted to kind of share with you. I think if you're contemplating these, and I think we heard this in the Blue Zone, just a couple tips, and I think I hinted at this, and I think it came in Marlene's question, is really go out and find very unusual partners, right? Who would have thought that libraries, barbershops, and restaurants would be major new vectors for scale for mental health services, particularly in the US, right? Think about this. So when Anthony Bourdain committed suicide, these kind of restaurants in the US had this has opened a crack that nobody's talking about. There's severe mental illness in people in the restaurant business, suicides and depression and addiction. And so they've now organized that they're now making the restaurant a place to create mental health that happens to serve food. right? Very different rethinking of the business model. So I kind of keep my eye on these signals. This is the slide I was saying that has Hooters on it. See there? As I was mentioning, all these logos never used to be in healthcare or well-being. They're all making plays, some more than others. Uber, I mean, when I used to run all the startups at Mars, everybody come to me, oh, I'm the Uber for pharmacy, I'm the Uber for PSWs, I'm Uber. Well, Uber is Uber Health. They have a whole company just for healthcare here. And there's Black & Decker, everybody. Virgin, they run primary care in the UK. So lots of interesting new partners who want to work with people like you. They bring capital, they bring technology, they bring deep, deep, deep consumer insight. And I tell you, like everyone wants to be all slimy, like go big tech. They actually want to do good stuff, right? They want their employees to be proud to work there. There's a whole macro change in what's, the social purpose of business. So just some examples. I did this for mental health. Walgreens, Marks and Spencer in the UK. They have these frazzled cafes. So imagine you have these Marks and Spencer stores, and now you can go if you're feeling frazzled, and you can have a space to kind of let that all vent out, right? This is a retailer. And then, I collect these like really extreme examples of multi-sector partnerships. I think it's similar to the logos you had in your blue zone. So in the Bronx is a big healthy buildings initiative to build buildings that create health. Look at who's involved: the priests, the power company, lawyers, the city, of course, the city public health, and then a hospital. This is the kind of magic it takes to get stuff done. And the skill set to work across all of these people really effectively, that's kind of our unfinished business, in my opinion. The second one is finding money in new ways. I can't stand it when people are like, oh, government doesn't pay. No. If your first answer to anything is to go ask government to pay, you're not thinking right? That might happen, and you want to count on that later, but at the beginning, no, you can get very creative with money. There's a lot of money out there. There's a lot of people who no longer consider their wealth transfer getting their name on the wing of a hospital, right? They want to create good for society, and they want to work with innovators who they believe are going to get them there. So these are just examples of new financial instruments, private equity funds, exchange-traded funds, lots of new ways to move capital to get social good done. When I was at Mars, we built an actual center of excellence for Canada to help organizations access this new type of capital, social finance, and we built the first impact bond for healthcare in Canada around hypertension. The infrastructure to do these as a real market instrument is just getting better and easier. So there's lots of new ways to buy the results you want without waiting for kind of a grant-like transfer of money. And then finally, and I think we heard some of this with the blue zones, if I look at my hope model, like I put blood, sweat, tears every day. It's so hard. We're doing all this work. I have nurses. We're doing visits. One policy change could open up so much impact, way more than me doing our work every day, right? So be smart about hacking policy. So it's like, I call it like writing regulatory code. When you hack your DNA, find a couple policies that'll open up everything. And every one of us have to be into policy innovation. You can't do change anymore by just doing whatever you do as a service. So just kind of thinking about your blue zones and these, I don't know if you saw, but Medicare, Medicare are the accountable care organizations. You guys seen all this? Everybody's trying to copy them. So basically telling a health organization, you're going to now be accountable to results. And we're only going to pay you as a publicly funded health system if you hit the results. We're going to penalize you if you don't. Ontario's salivating to replicate that model. Well, they did that at a community level. They released capital and said, a community, you find a way to organize yourself to hit these couple of KPIs for health of a community, and we don't care how you do it. We'll give you the money. Right? Very different approach that they did with pretty simple policy hack on just an incentive structure. So can't we do that? Another one, so remember the Golden Girls? There's an actual act as a private member's bill going through Parliament right now in Ontario called the Golden Girls Act. Believe it or not. But remember everything I said about housing and all these changes? It turns out pretty much all housing policy was designed for heterosexual couples to own a detached house. And everything else is an exception to that. And none of that makes sense in this era of multi-generational, a lot of widows, and then a lot of widows who tend to be women want to own homes together. But the law doesn't acknowledge that. So they've kind of got a private members bill to just start to say, we need, it says here, recognize that Ontario has an aging population and should encourage innovative and affordable housing solutions for seniors. So basically they're amending the Planning Act to add including, for greater certainty, unrelated seniors. Because before, the only way you could go in on owning was if you were related or married, right? So that's the kind of policy innovation. And then that's starting to happen with other things. And I think Alberta, particularly Calgary, has probably been also the most progressive. What does it mean to rent versus own? And how do you zone differently and adjust if maybe your kid wants to move in, or your mother, or whatever? So in Hamilton, they've kind of created these different modular things. So you could have a 1 unit, 2, 3, 4. Orange is owned, gray is rented. All these mixes that you can, if equity changes, you can bleed into the renting versus own. That's all policy innovation to allow this new stock of housing to be built at scale. And then laneway housing, I think Alberta is probably the most advanced in creating kind of environments to test these, and we've just passed policy in Toronto to allow these kind of coach houses or nano suites or whatever. So anyway, hopefully that gives you an idea that, housing could be a great platform to achieve a lot of other goals, and it's going to take some pretty creative new types of working and new partners, and if that's what you're doing, keep doing it, and if you're not, call us. I'd love to work with you. Thank you.